Okay, and we're broadcasting. Welcome to the latest edition of Medcan Presents, the twice-a-week webinar series that happens every Tuesday and Thursday at 12:30 p.m. My name is Christopher Shulgan, and I'm part of the team that creates content at Medcan. Our two hosts today are Medcan President Ashim Khemani and Medcan Chief Medical Officer Dr. Peter Noor. I'll read their bios for context and then hand it over to Ashim and Peter. And I should mention, we will be taking questions at the end of the webinar. Ashim Khemani is Medcan's president. In previous roles, he was the founder of STEM Capital, the president of Medavie Blue Cross, as well as the CEO of Aon Canada Hewitt. He is a board member of LEAP, the PICO Center for Social Impact. Dr. Peter Noor is Medcan's chief medical officer. Previously, Peter was a VP CMO at Unity Health Toronto. He is the founder of Stillbrook Accessible Retirement Residence, a registered charity focused on developing affordable retirement living communities for lower socioeconomic frail seniors across Ontario. How are you, gentlemen? Ashim, why don't you start things off?
Chris, thank you for the introduction and welcome to all our attendees. In the interest of time, I'm going to invite Dr. Noor to get us started, and then I'll tag in after that to give you some more detail as to how we are serving clients. Peter, over to you.
Thanks, Ashim, and good afternoon, everybody. Nice to connect again on a weekly basis. Well, it's interesting times, for sure. Interesting times, actually, among interesting times, as we've started to take a bit of a breath or a bit of a pause in the craziness that we find ourselves in as employers over the last number of months. What we've been hearing from our corporate clients and our partners is that we really want to take advantage of this pause to start to plan for the future. What does that future look like? So if we back up a couple of months, the pandemic obviously started in China and then rolled across the various nations. At Medcan, we were watching this very closely through January. We struck our own internal coronavirus working group that met all through February, getting our own house in order, and started to recognize that what was about to hit us was going to be pretty significant. It was about that same time that many of our corporate clients also recognized that this was going to be a sea change in terms of what was going to be facing us all. And they reached out to us as their trusted source for health information and care. And at that time, we recognized that we probably had a role to play into helping all of us steer through this challenging time together. And so we developed an advisory service for the corporate clients to try and deal with, in a very short period of time, what we've all dealt with, which is moving virtual, moving remote, working from home, basically dealing with the lockdown, with an economic lockdown. And so that was a very stressful period. We all had to pivot very, very quickly, literally in the space of days, not even weeks, and adjust to the new environment in a way that is going to benefit not just our employees, but our communities and our population around us. So very broad-based strategies to improve the outcome for the health, literally, of the nation. So that was a period of frenetic activity that we all worked through very, very diligently. Many of our teams in the different employer groups have been working 24/7 to try and implement this in a way that met all guidelines and kept our staff and our customers and ultimately our community safe. And about 3 weeks ago, that had all settled in, and for many of our clients, it was a time that now we could pause, take a breath, stop working 24/7, because we had achieved kind of a homeostasis in the new world order. And now, as things are starting to change in a positive way in terms of returning back to work, lockdowns being lifted, various sectors just starting to barely open up, parks are opening up, hardware stores are opening up, some client-facing, street-facing retail outlets are opening up. And it's a sign of more to come. We're winning the battle against COVID. And now many of our clients, as recently as 4 weeks ago, we're thinking, okay, what does that look like? So we've just gotten used to working remotely, having a large workforce, not having to commute onto site, risk management, cash flow management, supply chain management, distribution channel management, all of that basically done just for the time being. Now, even that landscape is starting to change as the guidelines, as the regulations, as public policy is changing by the day, by region, by municipality, by province, and across the country. The challenge now is how do we start to bring back all of those workers that have been working remotely? What does that new transition phase start to look like as we ultimately shoot for what we think is out of the horizon, which is that new normal, is that end state that we're all looking for, which is that next level of homeostasis between what is virtual, how much work can we do remotely versus what needs to be on site, what work needs to be client facing, what doesn't need to be client facing, what can we do from our back office, and how do we even start to think on a strategic level about our value proposition. The value proposition of our organizations may have changed in the last couple of months. And so it requires some thoughtful introspection, frankly, connecting with internal and external stakeholders to get a sense of what is the business that we're going to be in a year from now, and then back up into what do we have to do now over the next several weeks or several months to get us there. So what is it that we can do from a pandemic perspective as we start to turn the corner? So, and we're starting to see that the case rates are dropping. In the next couple of weeks, we're going to see mortality rates start to drop in various jurisdictions. And as that confidence is built up, the opening up of essential services will happen more, and eventually we will end up getting closer to what the new norm will be. Certainly, social distancing is going to be with us for the long term. Hand hygiene, those basic first principles of preventing transmission will be with us for the next several years. It may never actually change. But with those allowances in place, how can we still do business? How can we still take care of our staff? How can we provide a safe environment, a brand new ecosystem that is really focused on serving our customers and literally keeping them safe, which is something that many of us never had to think about. And also, how do we provide a secure ecosystem for our staff, our internal stakeholders, again, and how do we keep them safe so that they feel comfortable and confident coming to work every day, knowing that as employers, we're taking them under our wing, we're actually protecting them and allowing them to support the business in a way like never before. So by way of context, changing environment over the last couple of months for sure. We're going to continue to have peaks and troughs of frenetic activity as we respond to government policies that are going to be changing week to week to week over the next several months. But ultimately, the challenge is to start to think about what does your business look like out on the horizon? And then how do we get there in a logical way that is as efficient and effective as possible so that there's no wasted steps along the way. That said, if there is a second wave, public policies might tighten up. And so the process might be 3 steps forward, 1 step backward, 3 steps forward, 1 step backwards. But at least we have a game plan. If we have a game plan, we can anticipate that proactively instead of being in a reactive mode. The business is going to do better in the long term. And those businesses that can deal with some of these challenging questions up front, literally over the next couple of weeks, will be those businesses that emerge from this more competitive than their peer group. So there is a very challenging time ahead of us, but for some businesses, this is actually a huge opportunity to leap forward, to be innovative, and to come out of this stronger and more competitive than they ever have been in the past. So with that, by way of context setting, I'll turn it back to Ashim.
Thank you, Dr. North. Thank you. So as we are serving clients really in 2 areas. One as advisors, and secondly as service providers. And from a service provider context, we are both clinicians, technologists, data scientists, and management consultants, really. So those are the capabilities that roughly 500 Medcanners possess today that have been brought together in order to develop and deliver the Safe at Work system. There are three things that we are dealing with from a client context standpoint. One is that our clients are global, multi-industry clients. We have local, multi-industry and single industry clients. And then we have mid-sized businesses that could be in one location or more than one location. So the nature of questions, the nature of priorities from each of these three sets of clients, in some respects have a massive overlap. In other respects, they're quite unique to those clients. So as Peter mentioned, one of the first things is around assessment and discovery and policy development that becomes quite central. The second thing is that the clients have understood that this is not an episodic priority for us to deal with, meaning that we don't have to solve for what's here and now over the next 4 weeks, 8 weeks, or 12 weeks, but we have to effectively be in this posture through 2021. And then through that time frame between now and then, testing, treatment, and tracing will all continue to develop and evolve. And employers will need to be able to lean into all of those three priorities and determine how do they leverage progress in those three domains to be able to serve their workplace priorities. The first and foremost, that one thing that is uniform though across the board is essentially the physical health and psychological health of employees and their sort of hopes and fears in both being willing to come back to work and then being reticent about coming back to work and dealing with really, really unique situations from a home front standpoint that influences an individual's decision to return. So we have just put together the Safe at Work system. I'm going to quickly flash through some slides, not go through them in detail, but to give you some context in regards to how we are going about the approach, really. So from a context standpoint, again, these are the 5 questions that we are finding employers are consistently being faced with, and we are in turn responding to them. One is, when do they bring employees back to work, and where do they bring employees back to work? And then what is the publicly available data, both from a health and regulatory standpoint? And how do they sort of interpret that data for purposes of informing their decision? And then thirdly, baseline personal health information. What should they collect? What should they use? What are the privacy implications related to that? What is a longitudinal view around maintaining and managing this data as it relates to their relationship with the individual? And then of course, all of that on a group basis as well, a population health basis. And lastly, how do they sustain that? They know that it's almost certain they'll continue to encounter new individuals in their workplace who may be diagnosed with COVID. The prior decisions around shutting down the workplace, do they still prevail? What happens if they are in more than one location versus in one location? So all of those dynamics really are consistently being presented to us in the form of the questions that we are navigating and responding to. So the Safe at Work system really solves for those 5 questions. And if you just glance through to the left-hand side of the slide, you'll see, first of all, it's evidence-based, which is central to really our offer at Medcan broadly, and more specifically to Safe at Work as well. And it's connected to public health. So we're not trying to compete or offset local public health guidance. And the assessment is both at the individual level, from an employee standpoint, and the work site. That's really important. You can't just sort of solve for one priority versus the other priority. And then the reporting and decision support that comes from that. And finally, compliance, privacy, and security. So the Safe at Work system has these 5 core beliefs that are in flight right now as we solve client priorities and client problems. And this is really the, if you will, the principal architecture of the Safe at Work system: assessment and customization, communication and execution, monitoring and management. As I promised, I won't go through every element of the content on the slide. I'll just draw your attention to the middle corridor, which is the tile talking about questionnaire, physical exam, and lab tests. I think it's really important that all of us take a moment to reconcile with the fact that testing will be central to sustained reopening and any course correction. And in Canada, testing is right now being done for COVID diagnoses by the public health system. But as time progresses, it is fully expected that that will be broadened in terms of both the private and public system playing a collaborative role and the nature of tests becoming much more rapid. So Health Canada is right now in the process of reviewing new applications for a variety of different tests. And then the same thing will hold true for antibody testing. And later on, there may be questions, or Peter may want to take a moment to explain the difference between these two tests at a high level, but also the emerging science and validity of antibody testing. Those of you who may have been following the news network globally, you would have heard about at one point in time, if someone has the antibodies and they're free and clear, then you hear about the fact that, gosh, not so much. Then you hear about false positives and false negatives. And then you further hear about the fact that the degree and duration of immunity may differ. So that research is still evolving and developing, but there's no doubt that both diagnostic testing and antibody testing will be a feature here to stay well into the vaccine being available. And until then, employers will need to determine how they interface with the testing regime from a public and private standpoint. The next aspect I think is very important is that education and communication is central, and education and central communication cannot be episodic. It has to be organic, because we are serving clients right now, as an example, a group of clients where employees never left the workplace. So the things that they did to create confidence and safety in the minds of those individuals, that priority is largely behind them, because those employees have been working in the workplace for over 2 months and they're squared away. So clients did nursing hotlines, on-site nursing, screening, and other such sort of services to create confidence in the workplace. Now they have to think about different groups of employees coming back into the workplace, and the dynamics of those will either replicate what they've already done with those who never left the workplace, or it could be different depending on the type of employees and the nature of the workplace as well. So the policy protocols that employers have to develop needs to encompass all of those things. And then as time goes by, if there is a wave 2, and the intensity of the wave 2 will again force us to respond accordingly, either in a narrow setting to a subset of our workplaces, or more broadly, depending on how distributed our workplaces are. So in that respect, communication and education and clinical support and policy development needs to be quite sort of dynamic and not static. And as we think about communication, one thing that is quite different this time around, employers are really demanding, and I think craving, and properly and appropriately so, that communication is not just towards the employer from a manager or team leader standpoint, or the employee, but also into the communities where appropriate, and quite importantly, and on the home front. So employees need to know how to navigate this situation, the COVID-19 dynamic, based on the personal dynamics on the home front. So communication through employees into families is really vital. And so multiple modalities, a dynamic communication, multiple stakeholders are at the heart of what we are doing to serve our clients. Here, we very quickly talk about the screening and sort of determination. Do you do do you do screening at all? Do you do paper-based screening? Is it app-based? And if yes, then what to the employees? So we need a closed loop process depending on both the screening protocols and the execution of the screening, and quite importantly, based on the results of the screening. Employers are having to go back and revisit their benefit programs design. They're having to revisit their comp design, not in the immediate term, but they are getting questions, and they are making dynamic decisions based on, what do I do with the immunosuppressed subset of my population? I do not have a short-term or a long-term disability program with them. Do I create a new plan design, and how do I treat my employees equitably? So all of those things really are in play and are actually already being addressed and solved for in different employer settings. And then this is really a high-level overview of testing, and then how will we sort of solve for when testing becomes part and parcel of what employers will adopt or plug into from a public health system standpoint, and what will be their obligation and responsibility to both contribute data and leverage that data that's available. So this is a quick sort of snapshot of the Safe at Work system. I'll pause, and before I turn it back to Chris for questions, maybe Peter, if you don't mind taking a minute to just talk about the testing dynamics.
Sure thing. So testing has, as you've mentioned, has evolved dramatically, and there are two tests. There are basically two types of tests that are out there, and it's easy to get confused. And so that's really important. What you'll see when you watch the media, at least in Canada, is you're going to see nasal swabs and throat swabs. People either drive by in assessment centers and emergency departments, and that is a specific test, and it's called PCR, and they're actually testing for the DNA, actually a portion of the DNA of the virus, and they grow it in a lab based on that swab, and it tells you one thing, and one thing only: either there is a certain concentration of virus in your system or not. It doesn't mean there's no virus. So tests can go from negative to positive to negative, and that just means that at some point there's enough virus to trigger the test to becoming positive. And that's all it says. And for the most part, in many people, that duration of positivity may only last a few days. In some people, it can last as much as a couple of weeks. But typically at the tail end of that, if somebody's immune system is killing off the virus, even though the test is positive, we think that the infectivity is actually quite low. So the risk is quite low the farther you get away from that acute episode that typically lasts for most people 4 to 5 days. So that's one test. The second test is a blood test. So we call it serology. It just means a blood test. It's a finger prick, not unlike a diabetic person who has to check their blood sugars. And it's a little cassette. Drop of blood goes on the cassette. And in a relatively short period of time, depending on the manufacturer, anywhere from minutes to hours, you can determine whether you have immunoglobulins, and the short form is IgM and IgG. And that's our typical immune response to an antigen. In this case, the antigen is the virus. So it doesn't tell you whether there's virus present or absent. It tells you that your system has recognized an exposure to COVID-19 and has mounted a response that's killing the virus in your system. And that immune response will be protective, but we just don't know how much and for how long. Is it days, weeks, months, or potentially even a year? So there's a lot of questions about the immunity test. The test itself has a false positive, false negative rate that's associated with it. That's what Health Canada is looking at, just from that aspect of it. But in fact, the bigger variable compared to the variable on the test in terms of accuracy is the human factor part. We as humans have varying responses of immunity against these different antigens. And that's the wild card. And we really haven't had a long enough exposure. I mean, we're really only in month 5 globally. So we really haven't had that chance to see long-term, how does the average person's immune response match up over time? Ideally, if you can match these two tests together, that gives you a lot of information. So presence or absence of virus and presence or absence of an immune response against the virus. When you marry those together, you get a very, very good picture of what's going on in that individual.
Thank you.
Thanks, Peter. While we're on that, we have several questions. But so while we are on the topic of of testing, can we talk about the actual mechanics of testing and how do you see that panning out in terms of, you know, if an employer has employees who require testing in order to come back to work, where do they go to get tested? Are they being tested by the private sector? Are they being tested in some public hospital facility? How is that working specifically? Have you had any guidance for that?
Yeah, not really, because as we've said, that the immune test has not been licensed anywhere in Canada. And believe me, we're on the front edge of that. Like, we're watching day by day what's happening, because we want to be the first there to really leverage the ability to do this kind of testing. It's just not there today. So today we have really very few options. It is entirely, testing is done entirely through the public health system, publicly funded health system. So either through assessment centers or emergency departments, essentially, for most Canadians. In order to qualify, and again, going to an assessment center, it's an assessment, it's not a testing center. So when people end up going to the assessment center, many of them aren't even tested. If their symptoms don't reach a threshold, they're not going to be tested. So the only individuals that are being tested right now are individuals that actually have pretty significant symptoms. As the availability of that PCR testing increases, as manufacturing of the test improves, the threshold for testing will actually start to drop lower and lower. So instead of just people with the most severe symptoms being tested, now we're going to start to test moderate and even mild symptoms eventually. And that's going to give us an important body of knowledge from a public health perspective. So from a population perspective, critically important. From an individual perspective, actually not that helpful, because unless you're being triaged into the hospital because you're so sick, you need to be in an intensive care unit bed, the treatment is essentially the same. It's Tylenol, rest, and fluids, positive or negative. So the real benefit of testing is really when you stand back and start to look at managing a population, which is really what our public health experts are really focused on. And of course, all of that is to try and protect our most vulnerable individuals in our society, frail seniors, immunocompromised individuals, and individuals that have other conditions that make them susceptible. So with that said, everything else is hypothetical, but we're anticipating those tests coming online so that we can now, when that does happen, we can start to engage with our clients, our corporate clients, through Safe at Work, so that we can make this available. And so in that situation, the answer is we fully expect that the private sector, that employers will take on accountability for their employees when it comes to keeping them safe. It goes back to my earlier comments. The priority in the future state is that employees feel safe at work. And in fact, if they test and that test helps them to feel comfortable and confident, then it's money well spent.
Thank you for that. That answer tees up nicely for another question that was asked during the webinar. And Ashim, I think I'll direct this to you. What advice do you have when an employee is not satisfied with measures the workplace has done to keep them safe? The employee is currently on STD benefits, as she is still fearful for contracting COVID regardless of workplace measures.
Yeah, so employers are dealing with three issues there. One issue is that they need the individual back at work, and the individual employee is not comfortable coming back to work. So do they now have an abandonment of duty situation, and is that effectively a resignation? So they have an employment law issue that they are navigating in that regard. The next element that they're navigating in that regard is an occupational health and safety element. And the third element that they're dealing with is an employee culture question, really, because this information and the decisions that employers make in regards to these situations are going to have an impact on the culture of the workplace. Plus, the employer has to juxtaposition any choices that they make for individual situations to be universally deployable, because equity matters in that regard. So although the state of emergency that the provincial governments across the country have been using to work across, if you will, or have more authority from a law and order perspective, that has not created any offsets with respect to employment workplace issues. So the bottom line really there is that employers have created policies whereby they are proactively communicating to their employees the obligations that the employees have as it relates to working remotely or working on site, and making specific prescriptive accommodations for home situations to allow individuals to have some exemptions there. So that's one choice. And the second choice employers are making is they are changing their casual absenteeism programs or short-term disability programs, but doing it on a time-bound basis to accommodate the dynamics related to COVID-19. And lastly, forgive the repetition, early on I talked about the fact that in one case, not in one case, in three cases actually, we have clients who have, or very large clients, and they have several people who are immunosuppressed. And because they're immunosuppressed, they've had to create an accommodation for them to be away from the workplace. But what they've done is they've done that in the context of a policy versus an individual adjudication decision in that regard. If I may, something to just build very quickly on what Peter said, just over 3% of Canadians have been tested. 94% test clear, 6% test positive. And now, of course, the recovery rates are going up at a much higher rate than fatality rates, which is a great sign. But we have to continue to keep in context that only about 3%, 3.25% of Canadians have been tested. Back to you, Chris.
Thanks very much for that. We are out of time, and I'm cognizant of the fact that everybody has other calls and other webinars to get to. So thanks very much, Dr. Nord. Thanks very much, Ashim. We do these Safe at Work webinars every Tuesday at 12:30. We have a slate of other webinars coming up. Thursday, Leslie Beck, our Director of Food and Nutrition, is conducting a webinar on mind diet for brain health. Friday, we have Mindfulness for Leaders during COVID-19 with Michael Apollo. And then Tuesday, we have the next Safe at Work System webinar, which is Return to the Workplace, Checklist Considerations for Employers with Dr. Peter Nord and Andrew Zemakis. Thanks very much for participation. And thanks very much, Ashim and Dr. Nord.